Danielle. I'm going to be your nurse today. Can you tell me your name and date of birth?
Elizabeth Burr, 8/16/97.
Okay, well today we're just going to go over a breast self-exam and just show you how to do that and go over some history. Is that okay with you?
Mm-hmm.
Okay, so I'm just going to ask you a couple questions. Do you have a history of having any lumps or masses in your breasts? No? Okay, any pain along with that? No? What about discharge?
No.
No? Okay. Do you have a history of family or breast cancer in the family?
Yes.
Yes. What side of the family
Both.
is that on? Both? Okay. So usually, typically doing a breast self-exam, you would do it once a month. If you still have your periods, you would do it right after it, kind of keeping it on like the same day. If you don't have your periods anymore, you would just pick a day out of the month and do it every day. So I'm going to show you how to do it, and then you can show me, so you know how to do it. Okay? So first, you're just going to get in front of a mirror and just stand with your hands on your hips. And you'd be looking for color, symmetry. Usually one breast is larger than the other one, so don't be alarmed by that. But if there's like noticeable swelling or any milky, bloody, yellow discharge, you would want to contact your physician. Also, if there's any inverted nipples, or like say your nipples change, or if there's any puckering, you'd also want to contact your physician. Okay, so after you stand with your hands on your hips, you would then raise your arms to the ceiling and looking for the same things, any masses, color, swelling, discharge, things like that. Okay, and then the next thing you would do is you would like say lay on your bed, lay on the floor. Like if you were to do your left breast with your right hand, you're going to start, you can do it two ways. You can start in the middle, right at the nipple, and go around using the 3 pads of your fingers, making like a circular motion, kind of the size of a quarter, going around feeling for any lumps. You go all the way around, making sure you go from armpit to the middle, to your cleavage, and then clavicle to your abdomen, so you get all of this space. You go in circles, or you can start and go vertical, all the way down, doing circles, and going up, kind of like you're mowing the lawn, okay? And then after you do that, you can go deeper palpations to feel for any lumps that might be deeper down. Okay, so then you would do that to both. Now, some people like to do this after they get out of the shower because their skin is slippery and more wet. It's kind of your preference, whatever you want to do. So if you, like I said, if you find any lumps or masses or discharge that's not normal for you, contact your physician. Okay, so can you show me how to do that?
So I would first stand in front of a mirror, put my hands on my hips, inspect my breasts, looking for symmetry, like discharge, and like notice any like dimpling, any of that, and then put my hands up and do the same thing, inspect. And then I would,
You can use this.
take
I didn't, but
my breast and like start at the nipple, go in circular motions, a light palpation.
And what's the other way you can do?
The other way I can do like vertical, like a lawnmower.
Okay.
Up and down, and make sure I cover the whole area, armpit to sternum, clavicle, below my boob.
Okay. Okay. So if you do find if you find that one breast is larger than the other, that's normal. Correct. Okay.
Yes.
Okay. So if you have any questions for me?